Hey guys, Dr. Nick here from HealthSource Chiropractic. This week, we're talking about something that you might not correlate with chiropractic, and we're gonna be talking about your feet. You know, for you guys especially that stand on your feet for 6 to 8 hours a day, or you do a lot of transitioning, your feet are the foundation of everything that you do. So when your feet aren't working well, when they're not functioning, when they're not moving like they're supposed to, we end up seeing a lot of different problems. And, you know, we talk about some of the things that we see a lot, which is plantar fasciitis, heel spurs, Achilles tendonitis. These are all things that happen really often that we see and treat a ton in our office. And people say, well, what do you treat in those situations? Well, there's a ton of things. You know, the foot is composed of 25 different bones and 30 plus different joints. So all of those things have to sit and fit just perfectly together. When they don't, it can lead to some of those problems that we just talked about. So one of the biggest things that we work on is restoring movement, making sure the foot is really well aligned, and then talking about how we keep it that way and stabilize it. And one of those things is an orthotic or a custom shoe insole that helps your foot, gives it the support it needs to make sure that it's not getting fatigued, worn out, and make sure it doesn't break down. So if you have questions, I know a lot of people have feet problems, and they really don't think about reaching out to a chiropractor to talk about this. I just had a patient yesterday. She's like, I didn't know if you'd be able to help with this or not, but I thought I'd call and see. And we're gonna be able to help her a ton. And she's gonna be able to avoid injections and surgeries and all of those things in her feet, simply because we're gonna get in, we're gonna stretch the foot, we're gonna mobilize the foot, and we're gonna make sure that it's functioning like it's supposed to. Our foot is the foundation. I've said that twice now for a reason. If your feet aren't working well, your knees don't work well, your hips don't work well, before you know it, your neck and your upper back are a big problem as well. And, you know, just one quick story. I've had patients that, you know, we're treating for headache problems, and, you know, for some reason they just haven't responded as well as we'd like them to. And we start to look at their feet and their knees and their ankles, and we find that the problem is not necessarily in their neck as much as it is in their lower back or their feet or their knees. So a lot of times we start working on those areas in those situations, and these people get better really quickly, really effectively, and everything gets back to that kind of normal state that it's supposed to be at. So if you have questions on your feet, get a hold of us. Easiest way is just give us a call, 882-3726. If we're out and about and you see us, ask us questions. That's why we're there. Make sure that you get your questions answered. Again, Dr. Nick from HealthSource. That was your condition of the week, feet and ankle problems.